Florida set a state record for COVID hospitalizations for the third straight day yesterday, more than 11,500 patients. Florida and Texas together have about 1/3 of all the new COVID cases in America. President Biden criticized their governors who have blocked new COVID regulations.
I say to these governors, please help. But if you aren't going to help, at least get out of the way of the people who are trying to do the right thing. Use your power to save lives.
Joining us now is Dr. Ashish Jha. He is Dean of Brown University School of Public Health. Doctor, good morning. We always tell people, listen to the doctors if you are confused. So what do you say to the governors of Florida and Texas?
Good morning, David. Thanks for having me here. What I say to them is that these are very, very difficult times right now, and I would not see these things as regulations as much as public health measures to save lives. And there's a series of things we can do, because we've learned a lot about this virus, to get through the Delta surge and get to the other end and have a lot more people alive and safe if we make these public health measures, if we put them into place.
New York City, they're going to require people to be vaccinated before they go indoors. Do you believe at this point, given the available data that you've looked at, do you think right now mandates are our most effective way out of this pandemic?
You know, David, I do, and I don't know that we need to have a lot of government mandates, though I do believe what New York City is doing is really reasonable. Obviously, this is a choice issue for some people. They don't want to be vaccinated. I understand that. But if you want to participate in a restaurant, you want to keep restaurants safe, if you want to go to a hospital, you want to go into a university, it makes a lot of sense for those institutions to say, we want everybody vaccinated. It creates a safe space for people. So I support mandates. And I think that they are going to help a lot of people get off the fence and get vaccinated.
Booster shots. A lot of people will ask me when I'm out in the street, David, do we need booster shots? What do the doctors say? What do you think?
Yeah, this is one where my views have changed because the science has changed. We've seen a lot of new data coming out in the last month or so, primarily from Israel, elsewhere, that frail elders, for instance, who are more than 6 months out from their second shot, they may need a booster. Other people, immunocompromised people, need a booster. I don't know that everybody in America needs a booster. I think I haven't seen any data to suggest that's true, but I think for some high-risk people, boosters make a lot of sense.
Louisiana, it's one of the hottest hotspots right now. But you know what? As vaccinations, as the infections and hospitalizations are rising, so too is the vaccination rate. What do you make of that? A lot of people are scared right now, and that's driving them to get vaccinated.
Yeah, David, that's been one of the heartening things I have seen in the recent days, is that a lot of people in these places that have had low vaccinations are stepping up, are deciding that they want to protect themselves, they want to protect their families. They're seeing what's happening in their communities and getting vaccinated. Of course, I wish people had gotten vaccinated earlier, but at this point, we've got to do everything we can to protect people, and that means getting more and more people vaccinated.
Dr. Ashish Jha, thank you for your time.